Friends, today we will continue our conversation on the topic of the small intestine, and I will explain why inflammatory process in the small intestine will create acid reflux or GERD or gallbladder sludge and stones. Inflammatory process like celiac disease, IBS, Crohn's disease, peptic ulcer, and infections such as bacterial or viral infection may cause gallbladder stones and acid reflux. In this video, I will talk about secretin and cholecystokinin, but in previous video, and by the way, on my playlist, all videos on the small intestine mark as a 9A. I'll talk about serotonin, and in that video, I explain that small intestine is lined by villi. They are tall and there are crypts. So this is villi and those are crypts. This is how normal small intestine surface looks like. On the right, you can see where there is inflammation, villi are slashed, crypts are gone, and you can see 4 sites of inflammation. Also, in a previous video, I said that these villi on their surface have numerous cells, including neuroendocrine cells. The purpose of the neuroendocrine cells to produce different types of locally hormones. In previous video, I talked about serotonin. Today, conversation about secretin and cholecystokinin. The function of secretin, it has actually 3 functions when it's produced hormone, as a hormone secretin. It regulates production of hydrochloric acid, regulates pancreatic bicarbonate production, and it defines osmolarity, how much minerals in the solution there in the small intestine, and depends how much minerals the water will get absorbed from the small intestine into the bloodstream. Cholecystokinin responsible for production of bile from the liver and contraction of gallbladder. You may ask, by the way, this is my contact information. If you need me as a health coach, please feel free to contact me. Why I'm talking about this physiological function of those 2 hormones? When you understand when there is inflammation in the small intestine, villi get slashed, neuroendocrine cells are lost. As a result, those hormones produce either in small amount or not get produced at all. As a result, when they are not there, the effect on different organs will be seen in the patient in form of clinical picture. So let's go to the blackboard and I will explain what people will see when there is inflammation in the small intestine. As always, I pre-draw a picture of our digestive tract. This is the mouth with the teeth, and this is the food. When we are looking at the food and smelling the food, the signal goes into the brain. And from the brain, parasympathetic system get activated and send the signal, start to produce more saliva, start to produce hydrochloric acid, HCl, start to produce mucus to protect the lining of the stomach from the damaging effect of hydrochloric acid, start to produce digestive juices, pancreatic juices here into the small intestine. P stays for pancreatic gland. Also, signal will be sent into the liver, start to produce bile. Those signals are kind of preliminary signals to activate our digestive tract. However, when the food is arriving into the mouth and we start to produce more saliva here, and the food drops here, we produce even more hydrochloric acid and even more mucus. The purpose of hydrochloric acid to create pH of 2 to digest, it's very acidic environment to digest the protein here. pH of 2 here in the stomach and pH in the small intestine of 7, which is neutral pH. pH 7 is the best pH for the small intestine to make sure that pancreatic and digestive enzymes are working, breaking down the food. So as the food arrives here, we pump more hydrochloric acid to create pH 2, and that sends the signal from the stomach into the small intestine, start to produce more digestive juices from the pancreas and from the liver. When there is an inflammation here in the small intestine, let's draw a separate picture. Here it is. So this is the small intestine, and this is our villi and crypts, and neuroendocrine cells are here. When there is inflammation, so it seems it looks like that, villi basically are gone, neuroendocrine cells are lost, and production of secretin is halted. So secretin is not produced or produced in very small quantities. Remember, the purpose of the secretin, physiological function of the secretin is to tell hydrochloric acid, stop producing for stomach, stop produce a hydrochloric acid. So as you stop eating the food, you're supposed to produce a little bit hydrochloric acid and then stop it. If there is no signal here from the small intestine, stop production of hydrochloric acid, what you're going to do, you are going to produce more hydrochloric acid and more hydrochloric acid. This hydrochloric acid together with food will be staying here and may, because of the stomach is churning, go here into esophagus and create inflammation or acid reflux here. Also, purpose of the secretin is production from the pancreas, pancreatic juices, to make sure that you create osmotic gradient here to absorb the water from the small intestine into the bloodstream. If you don't create this osmotic gradient by lack of production of secretin, as a result, absorption of water is decreased, what can you expect from that? Dehydration. Okay, also cholecystokinin here on the surface of the small intestine when the food arrives here, it tells more liver, hey, listen, start to produce more bile, because more fat is coming here in the stomach and arrives here into the small intestine. So liver starts to produce bile. It does not happen in a matter of minutes. It takes few minutes. That's why the purpose of the cholecystokinin here also is to make sure that gallbladder, this one, is contracts. So the moment the first food arrives here into the small intestine, gallbladder get contracted, release the storage of the bile into the small intestine to make sure that that first arrived food get digested and absorbed from the small intestine into the bloodstream. Only then, 10, 15, 30 minutes later, the bile will finally increase production of the bile, and that bile will go into small intestine, and digestion and emulsification of the fat that have been here in the small intestine will continue, and actually you will emulsify the fat, will absorb it easy into the bloodstream. If cholecystokinin, the neuroendocrine cells that been here slashed, cholecystokinin is not enough of that is produced. As a result, bile is staying here. Gallbladder does not contract or contract very poorly. Bile is not produced. What's the consequences? Staying bile means creating sludge in the gallbladder, which eventually may convert into the stones, and also not adequate bile production for the small intestine. Fat is not emulsified, is not absorbed. A lot of fat get lost and goes right into the bathroom. Loss of the fat has its own consequences. Let's look again at the consequences of dysregulation or loss of secretin and cholecystokinin. So regulation of hydrochloric acid production. If it does not suppress production of hydrochloric acid, what person may have? Acid reflux. If bicarbonate is not produced, osmoregulation is impaired. What person with inflammation within the small intestine is going to have? Mild dehydration. Cholecystokinin, problem with the bile production and gallbladder contraction. Contraction of gallbladder, poor contraction of gallbladder, sludge and stone formation. Lack of production of bile from the liver will create malabsorption of the fat. So what that correlates with the clinical picture? Fat is responsible for building the wall cell of individual cells. So as a result, the wall is not built, body will start produce cholesterol. So level of cholesterol in this particular person or patient you can expect will go up. Also, bile responsible for absorption fat-soluble vitamins such as A, E, K, and D. A and E is skin problems such as eczema, psoriasis. K is responsible for coagulation, part of the coagulation pathway. You can see dysregulation of myopathy or bleeding in this particular person. And vitamin D is actually not a vitamin. It's a hormone which has effect on our own DNA and responsible for stop and go reproduction of the cell. And it's if there is a lack of vitamin D, there is a higher chance of cancer formation of all types of cancer. Okay, so thank you very much, guys. If you have any questions, please ask. All the relevant information in description below. Bye-bye for now. By the way, subscribe.